Welcome back to Good Day Stateline. Tonight we are chatting with Alicia Bobak, VP of Operations at Transitionscare. Hi, Alicia.
Hi.
Hi.
Thank you for having me.
Yes, of course. So tonight I know we want to talk about remote patient monitoring. Can you tell us what exactly that is?
Sure. So remote patient monitoring is also called RPM, and it's a service that we offer to our primary and palliative patients. And what that means, it's digital technologies to monitor and capture data and transmit it to real time. So what that means is it's Bluetooth devices such as a blood pressure monitor, a weight scale, a pulse oximeter, glucometer, and many other technologies that we use that are sent to the patient's home. And they utilize that daily. And in real time, we get that information to our clinical coordinators for any abnormal data points that we need to address right away. So it's offered to all of our patients on primary and palliative care.
So it's kind of like you guys are able to be there even when you're not there, right?
Exactly. That's 100% the goal is if we're seeing a patient weekly or every 2 weeks, on the days we cannot be there, we're still gathering information and being a part of their plan on a day-to-day basis.
So who qualifies for RPM and is able to have this as part of their care plan?
Sure. So RPM differs a little bit from our chronic care management program. RPM, it's any patient who has Medicare or Medicaid, and a lot of commercial insurance covers RPM as well. They don't have to have true chronic diseases. It's if the provider feels it's necessary for them for information in their plan of care, we can get them on the service right away.
Cool. So obviously we know it's beneficial because you're able to be there when you're not there, but what are some other benefits that the patient gets from using something like remote patient monitoring?
Sure. So they feel a part of their care. So we're having them put the blood pressure monitor on them, or their patients' family members or caregivers are assisting them onto the weight scale every day. So it helps improve the care plan adherence as well, and it makes them feel a part of the team. It also builds patient engagement and improves patient experience on their end. It also improves access to care. So in the rural areas or areas that providers may not be serviced for, we can get at least RPM in there to start to make sure we're getting data on them, and we can do telehealth with them based on their data and their readings. So it's really getting a grasp on their care even before we can get to them.
I feel like it probably also is helpful for the family or, a caregiver, whoever's at home with that patient, a majority of the time, that probably feels like they are able to take a bigger breath because, that monitoring system is there and they have a partner, even though it's not a real human being helping out.
Exactly. If they're not feeling well, if a patient wakes up and, they're dizzy, they have that blood pressure monitor access to them. They take their blood pressure, say it is low, that reading will come to us automatically and we can address it with them in real time.
That's so cool. So how does Transitionscare use this to improve care outcomes?
So we want to improve care plan adherence. So for example, if it is a hypertension patient, if they're not taking their blood pressure medications, we can identify this by sending the blood pressure monitor through RPM, having them take their blood pressure daily, and identifying areas that we need to improve on. It also helps with 24/7 access. So our company, we have 24/7 on-call staff as well as an on-call provider. So if a abnormality comes through from the RPM data, we address it in real time. And that is crucial so the patient is not waiting. And we identify that. So the patient may feel okay, but we see that they have an abnormal value. We call them and they may tell us what's been going on. It may be very mild symptoms, but we're addressing it early on to really prevent that ER visit or unnecessary hospitalization where we can treat them at home.
That seems really incredible.
It is. And, we have a lot of great patient feedback. Like I said, they feel like they're a part of their care with this program, and the caregiver and family members as well.
Awesome. Well, thank you so much for joining us tonight, Alicia.
Thank you.
We'll be right back with Sweet Tooth 815.